a simple act of kindness will make their day better, will make their life better.
If we go beneath, truly care for our patients as a whole human being and be compassionate at every moment that we can.
We are treating the patient as well as the family.
Every moment we have is an opportunity.
A single act of compassion, at the end of the day, the profession should add a more meaning to your life.
Before we move into the episode, if this conversation resonates with you, please like, subscribe, and share this information with anyone you think should listen to this. Your support helps us bring this information into the world, and it helps us embed the culture of compassionate care even further into our current healthcare systems. Thank you.
Dr. Kripa Bajaj, welcome to the show, and thank you for being here with us to share your knowledge and expertise and your stories of oncology. Thank you for being here.
Thank you so much, Shivaraji, for this wonderful invitation for Bera. Looking forward to interact with you and discuss more about our journeys.
Can you introduce yourself and tell us a little more about your work?
Myself, Dr. Kripa Bajaj. I'm a consultant medical oncologist. I deal with both hematological malignancies and solid malignancies. My area of interest expertise is more predominantly towards women oncology, breast, gynae, and lymphomas, genitourinary tract malignancies. I work in Omega Hospitals, Bajaj, based in India.
So are you on your own or is it a group practice?
So I'm working at the largest oncology chain in India, Omega Hospitals. We do have multiple sectors and multiple places in India. It's a private organization, but it's the largest cancer network in India.
That's what made you go into medicine and then oncology.
So medicine actually to begin with, it's my maternal grandmother's instinct towards medicine. She always told me you have to help people, then only your life will have some meaning. So I didn't the immediate physician is better than daily medicine because in India, a lot of underprivileged people are there to access medicine. But so that didn't need to take up medicine. About the oncology part, my father himself is an oncology patient. Initially, when I was doing internal medicine, my dream was to become a dermatologist or neurologist. But at the end of third year of my internal medicine residency program, my father asked me to visit 4 cancer hospitals and interact with the patients who are sitting in the waiting area. I was made to meet many patients and interact with them. So once and that elderly couple waiting to meet the doctor, and this said there is very few doctors are having empathy towards patients, especially pediatric patients that people set it as quick. So these are the exact words used by one person who is suffering from residual carcinoma.
That is beautiful. Seems like compassion entered into you even before you entered oncology, and probably that is what something shaped for you to go into oncology along with the family, friends, and the patients, but that you interacted with help you make these choices. I know you already talked about empathy a little, but if I say compassion, what is the thing that comes to your mind?
Compassion means just a simple act of kindness will make their day better, will make their life better. So that's what suppose in amputation they do other the other thing. Then we will opioids will document their life better. For me, timely attending their calls or attending their care will make it in a lot of anxiety. Simple words of reassurance will make their life better.
That's great and powerful. I think it's also reflecting back what your grandmom said about helping and caring for people, right? Which is a powerful thing too. Not just with our clinical abilities or the diagnostic skills, but it seems like we can also do that through our words and being with them and understanding them as well, right? Do you think compassion is important in healthcare? And if so, why?
So whenever we are interacting with the patient, we are not just treating the ailment of the person. We are treating the patient as well as the family. So we have to treat important, not just solution. For suppose someone came to with cancer, just not simply prescription of medicine will not work. And after what are his fears, what are his this thoughts. So all those things understand. So we have to understand what exactly is living problem. I take an example. In India, most of the state cancers will not be disclosed to the patient directly. Family asks us not to disclose to the patient because patient will get excited, something like that. But actually in USA, it's always written that let me disclose the patient first, then only to start the treatment because the intention of treatment has to be clear. Whatever wishes is having in patient within whatever duration of time is left. That's what we would but in practical, practice, uh, when they're interacting with the patients, they always say whatever problem he's having, let him be useful and let him be talking. That's not families who ask us. So to make his life better, our her life better. Maybe person is having 2 years of life like that, not 5 years of life. Let so that's what we do.
Got it. That must be a little challenging, right? I mean, trying to treat somebody without truly giving them all the information, right? And how do you manage that? If somebody's coming to an oncologist, probably they will have some thoughts around it already. And if you're giving these treatments with all those side effects, and how do you manage that information of not revealing the diagnosis or not revealing the information? How do you manage that?
So we also will within the family. Given actually in oncology, patients and families trust us a lot. Usually, we sometimes we don't disclose the cancer or the first cycle. She'll get frightened if you say cancer giver because some people are very uneducated. They can't hear that now cancer treatment and cancer cure is almost 95% cure at when cancer most of the cancers. But still, in India, because it's an underdeveloped country, when they reveal the word cancer, the thing what comes here and is the death. So we have to guide the patient slowly to the treatment, assuring that the cancer death. By the time they enter the second cycle, third cycle, the themselves will understand because like the patients around which of the circumstances they are into, they'll understand it. But initial first, second part, it's very challenging because opinions are what that's going to happen here. And most of the people who are because I did a lot of testing, people are most of them are uneducated and they're not well exposed in society circumstance. Family, kids, and everyone asks us how to discuss start this like a you sit with them, counsel them, you start that you are giving antibiotic to the patient, but then it will tell the patient. But it's very difficult for us, we know that we are not giving truth to the patient. But family and us will have a strong understanding. Let us go forward. So later we will slowly disperse. So that's where. And that's how we most of 60% of times we do start a journey with the cancer treatment the same way. It's not that we're having stage 4 cancer, you're someone will give in, someone will go to get this 1 year, 1.5 year, like we will not discuss because family and the doctor will have a deep understanding. They'll slowly do it.
Are there situations where you actually are, or the percentage of people where you are not able to disclose that information till almost the end, and we are closing that end of life, and they go away without knowing what they had? Have you had situations like that?
Simply conclusion in life. By the time she finished the 4 months of treatment, she landed with us in accepts it. So then she asked me, madam, please give me the truth what exactly the diagnosis. I'm going to die with them, mom. What your story will be exact with her.
But I think that makes me feel, I mean, I'm sure that knowing that in that last minute compared to knowing 6 months to prep, I don't know, it's all that balance, right? It's balance of like, do we really want to give that information and have the person go through that process of grief and acceptance? I think grief itself has a stages of acceptance, right? Like initially we deny, then we accept, I mean, then we bargain, then we accept. So there are stages. If I feel like if we give that in the last minute, I don't know how they probably would have to breeze through those stages of grief and finally
Exactly.
accept. Or so what do you personally think
I do feel one
they
should
should?
yeah, we should disclose everything to the patient at the base. Yeah. And but uh, people Everyone knows that everyone is having a degree than heart attacks and cardiac patients, cancer patients are privileged instead of having a often the timeline, typically need from so those families we have a tricky situation and we will respect that. Though every docs will be fitting towards disclosure, sometimes not disclosing they want their life better. So today I saw one patient who is supposed to take adjuvant cancer treatment for inflammatory cancer. I started disclosing to the family, I mean, all the treatment, and I started disclosing to the patient. So then, some everyone like Jessica will have to disclose as well to represent the other outside the cabinet. Then they ask us, if you told them another, it's a cancer. So tell that it is simple gynec infection. So that's what they signaling. And she's also very present. The moment I asked, is there any family history of cancer, she started weeping. So these kind of patients, we have to motivate them at least to enter to the treatment so that they're not frightened to take chemotherapy. So in cancer treatment, it's always medical oncologists are available. They're not afraid of surgery, they're not afraid of radiotherapy. But they're significantly afraid of chemotherapy and its side effects. So to give chemotherapy itself is challenging to all the medical oncologists. So immunotherapy are targeted to giving them enough any difference in their lifestyle. Certainly will have side effects like nausea, vomiting, weakness. They will have a lot of fever episodes because of the low immunity. All these things are there. Even do have they are afraid of taking chemotherapy. So we have to slowly drag them. Once they gain confidence, then we'll understand what to disclose and what not to disclose. Then we'll slowly disclose. For curative intention, we don't feel any guilt because they're going to survive. But palliative intent cases, did we have a lot of guilt carrying because otherwise she should know this, he should know this, because he's only going to survive a couple of years to my will to live his life. I'm a patient, he is an attached at 3 it's a beta positive. The average surrounding lung that he has to 2 years, he has a any daughter, whom he really wants to get married soon. Bypass he not to disclose it. So, these are the wishes everyone wants to fulfill. So these are the really challenging situation to us. Are we loyal to the patient? Are we loyal to the family? This is the conflict you are thinking have in state for cancer patients.
Yeah, I think especially with the cultural beliefs, especially in India compared to other countries across the borders, I think it's definitely more challenging. And primarily, I think our responsibility is to the patient, but I think family comes in very closely, right, with closely in the management and the care that we provide. And I think that becomes challenging. But I feel like I would want to take this opportunity to and put it out to the audience that, especially the families here, that probably we should rethink about disclosing the information earlier on to the patient for those who've not been able to, and that way they have those opportunities to meet the loved ones, to forgive the ones who they have to, or like, right, to fulfill all those wishes. I think it would be nice if our families think a little more into this aspect. But talking about that, I think moving on from discussions surrounding families and the disclosure itself, oncology itself is a very compassion heavy field in general, right? And earlier on in your career, are there any instances or situations where you learned from the patient and you started seeing compassion in different angle?
Yeah. So I have a patient, Mrs. Silis sarcoma patient. I think he's a very well educated guy and very well experienced patient. He knows more than his issues than me. He read everything, all the articles and everything. So when he got cured and after 1.5 years he got a recurrent surgery. In the first year of my residency, he got diagnosed. And the 2 years again he got a recurrence. So then that we have to perform surgery. So we single young that's for the starting of which is later got a recurrence. Then I myself, like he's just 21 years old and I can show that for him. Then he counseled me, it's okay if I get cured, I got cured. If I'm not, it's okay. My life is limited to this in the next life I might be having a long life. So let me try hard, let me fight back there. If it's fine if I win. If I don't win also, that's a free counsel you do with them. Let us try and let's win together. It's not really sad. These are the patients who are really thirsty. And at the same time, have one patient forward, Jamaran, he was a blood cancer patient. He also got diagnosed in the suicide. He was a very, very small year. So the outcome is only going to be 20%. And upper of the university. Yeah, although I was really, whenever I speak to the father, whenever I speak to the family, they're very poor background. They, to provide effort to raise the son. So then I wrote it the first time I got to the father and mother. When they cried, I also cried along with them. Later, that the son is counseling the parents with his pride. The mother like, you'll worry. So you'll take care of yourself and don't spend nothing much money on me. And that, but nothing to survive, you're doing so well now. But at that time, the kind of courage he mustered to fight that. So that amazed me. The way he counseled his mother and his father amazed me. So I understood lot of counseling, like what are the sensitive points in the families. When I was doing medicine, it just started with, I did get figure people are going to survive. It's in medication, but start they're going to be better than what it was before. The concept is totally different. The first one for my residence is for music and too much of mortality around, and at the same time too much of fight around. So it's not like getting reverse. It's a chronic fight with 1 year of treatment, 3 years of treatment. Then I summer emission later after 3 years about the doctor for visit for the urine cancer. They stay up there and later they flee back to India to meet me. But we are having meaning for our life. We are doing justice to our profession. Right? So all that work has some meaning at the end of the day.
Yeah,
I
those
hope
are
my
all.
emotion
Yeah, I think entirely. I think I was getting filled with tears as you were narrating some of the stories. Those are all so powerful stories. And yeah, I think basically all these lessons that we learn from our patients, I'm sure shape us, right? So if we say, if we want to explicitly break down into lessons that we learn from our patients or early on in your career, can you point out a few of the lessons?
lessons. What I wanted to see, what the first lesson what I understood in the hard way was when the patient is becoming sick, please let go of the patient after because that's also a gift service. So I want to like there is a significant disease there in the media further. I want to do something to save her to struggling for breathing, to struggling to swallow. I paid what's one and a half in that time. Then I discussed with the professor, so let's fight to the something, and let us do everything and we have to make it better. So how long can we make it better? That's your nothing. So they tried to last minute before that. So that's what my mindset was that when not my residency, what I lost one of the HIV patients. So I think power of looking low is the most important for all cancer disease. 40% of your patients will expect, take the decision that
So you're talking about the financial constraints, right? I think that is one big thing that I would see as a challenge, paying out of your pocket, not specifically. I don't think insurance is plays a higher role there. I'm not sure how it's primarily, but how do you manage? I mean, when you know that there is something that this condition is treatable, but there are so many financial barriers that can come in. How do you manage and how can you be there for that patient and care for that patient? Is that possible at all? And how do you handle that? That's one question. The second question is basically emotionally, how do you handle this day to day? Like these are very emotionally, so how do you handle that? But we can go on to the financial constraints question. Yeah.
have a lot of financial capacity couple of months before, only because of the
Sure.
second question.
Well,
You have just a date between the death and life. Only God will decide what's the license written on the face of the person. So, what if so I do try to counsel myself most of the times because can if this patient is presented to me at least couple of months before, she will have said that. So all these things are running on mind. That's a destiny, it's a fate. That's yours. I console myself when I live and face things or something. And when I see families grieving for the below them. So, and I still getting adjusted to things. I think it's very. take some more time for me to get, to balance all these aspects.
So, yeah, that's true. I think it's so important to have that understanding that there are things that we can do as a physician, but there are things that we can't do, and understanding where we can't do anything, if we can let go, then it becomes easier for us mentally as well, as what I feel too. Have you seen yourself changing over the course, and are you carrying a different dimension to compassion more recently compared to your earlier years?
Then I was not having a thoughts in their financial dimension also. So I have to balance everything in my take and they don't want anything mentioned and accepted because but you will lose your reputation. The metaphor has to be done like this.
That's great to know. To these components of compassion that you're expressing in terms of words and language, do you think there are dimensions of nonverbal communication that can actually show that or make the person feel that?
So, okay, simple patting on the back. So, suppose I want to examine the patient, and the simple pattern on the back, simple tap on the back, so your hand. So, always for me, and also simple token when someone is retrieving ammunition. The other aspect, every area do have their specialties. They have a, first of all, they want to suggest some diet to the patient. It comes from area where they think some rally or direct significantly. If I address them with the kind of diet they are actually from the staple food, they keep so happy. So these small things will make them feel so, attractive to you and they feel so, relatable to you. Okay.
Right. So, I mean, I see that probably may not have any barriers in expressing compassion, but you feel sometimes are there challenging moments or demanding situations or difficult days that you can be entirely compassionate. I mean, sometimes when we are probably carrying over from that some emotion from a different patient, and we're not in ourselves, right, with ourselves. So that sometimes that can be a barrier too. But things like that.
So I tell you only, I told you like there are a lot of financial constraints. So when I try to help the patient like that, they are treating unnecessarily. So that's what a mindset that most of the people who are the sympathy. So it's because of us taking a lot of efforts, sort of compassion, I try to guide them out of the way. So I went out of the way to write my international paper. So it was a very poor, I mean not poor, but I went out of the way 2 months. Actually, for Indian patients also, there will only one fever. I need them to access two fevers. When we got admitted, the bowel got delayed, they were delayed. So the company, because plate is Saturday, it's, most of the companies, was the guy which is start with years. Okay, really bad. I felt sorry for my side. I did so much to him, at least you should be patient enough to wait for the cup. So if he started abusing their including me, if we are not great, then a lot of efforts can ask. I do feel at least one incident a month I do come across.
Got it. So some of those things actually you feel like, yeah, get it. Yeah.
We should not be good to people. So sometimes I think that.
Okay. In incidents like that, I mean, yes, it's very human and natural to feel that why did I have to go extra mile to do all that? I mean, do you get that sensation? What happens and how do you handle those thoughts?
So again, I mean, in my life, my grandmother is a root cause for everything. My shaping my personality, shaping my attitude, everything. She always tells me, whatever others feel, do best from your side. Be truthful to you, be nice to yourself and your mentality. So always you should carry that mentality. You should not think what is the outcome from others. You should do what is best from you. So that always I do console myself.
Got it. I think that is so powerful, right? It isn't easy. It is not easy. And generally, I think we try to reciprocate the way we receive that, right? When we receive some in an interaction, if we receive it awkwardly or differently or with anger and frustration, we tend to respond and react back similarly, but holding us back and remembering that no matter what, how the other person is behaving, I mean, there is a possibility that we can still be nice and sweet and do the best we can for that patient. I mean, that isn't easy. And I'm so glad and I'm so grateful for your grandmother for bringing up and inculcating all these great attitudes in you. So that's so sweet. As we proceed, I think again, you've already mentioned quite a few end of life situations, right? And also letting go of when the time comes. So, on a day to day basis, how frequently do you have to encounter that? And how easy is it becoming to let go for you? And what are some of the things that you've changed in that aspect over the span of your
Letting go of the patient, like who got something under me, is a very difficult thing and do question because, like it's a kind of like you're born with you and patient. So you have a very subtle limits with the patients, right? So when they're good, they have brief interaction. So then, like suddenly some person, especially when curative patient became sick, and he actually landed no point of return. So then that's a difficult phase for us emotionally to handle because it ever this should not happen to him. We have survived well. But again, like I do console myself that like it's okay, this is your destiny, what is demanding, but like it's very difficult for me. At least couple of weeks I'll feel so sad. I just get a copy of the memories of the patient and the family do happen to me. Still in the process of becoming mature to handle the connections. I'm not really so mature to handle the emotions bluntly or so philosophically. I'm still like in the process of becoming strong to handle his emotions. I think at this point of time, letting go of the patient pain, the treating is the most difficult phase for any oncologist because there'll be certain bond towards the family, towards the patient. When we disclose the patients will get recurrence quickly. So those kind of issues, disclosing the bad news is also very challenging for us. I have a patient with a Hodgkin's lymphoma, a survivor, which she's just 23 April, very bubbling and enthusiastic female. She got cured. After 2.5 years, she got the recurrence in a very bad way. She's surviving and she got cured of the autologous transplantation therapy. But at that moment, when I was disclosing to the family, her marriage got settled and she got relapsed in a very bad manner. Entire body got metastasis. So then, she broke the marriage, and the family broke the marriage because this girl got with her, and he said a lot of things were happening. I had to disclose to the group's family also. So these things are very difficult. I'm still adjusting to the things because I do always feel sorry for the families and the patient who have.
how do you manage that? I mean, how do you handle that or cope with that? The difficulty situations. I mean,
So initially, takes a weeks of time. Now it is just taking days of time for me to recover. I mean, it's not just a trauma to the family; it's a trauma to the doctor also, who is displaced in there. Now I'm counseling myself once about to break. I don't say to myself that you're just a instrument in the hands of God. The delivering what is best from your side in the best possible capabilities. The result is not going to be in your hands, but God will give. So whatever is there, if I'm just started in the hospital, the home, anything can happen to me also. Just like that, it's going to happen to them. It's okay. You do your work perfectly. So this always I do tell myself, I counsel myself whenever any case happen, I mean, any of this sorts of happen.
yeah, I think there is the talk about self compassion as well, right? Like understanding what the limitations we have and accepting those limitations probably is also a little bit like the self compassion and accepting our strengths and weaknesses as they are too, both as a physician and also as a person. So, yeah. So, as we go forward in our conversation, so do you think there can be systems in place, or in general, what's it out there beyond yourself in terms of compassionate care in our health systems or in health system in India? What's the
I mean,
prevalence?
support groups plays a very important role in the cancer care for support to survivors or the NGOs. So those people will play a lot of role in the cancer care. So suppose people who are not accessible to the medication, we do have wonderful NGO system like alcohols to see a lung. They do serve for 6 years, 7 years, 8 years with alcohol inhibitor. But that used to be very costly. Government it used to cost 1 lakh bucks. NGOs used to provide those medications to the people who are alcoholics, which is a very nice thing. India government cannot provide insurance is not insurance will not provide insurance for the pills, but the NGO used to provide. There are lakhs of survivors because of that. So these kind of support systems are robust, but still many people cannot access it because of the various reasons. And also, most importantly, emotionally, the compassion is at the meaning the tendencies, but apart from that, emotionally, there are foundations where they do address, especially breast cancer survivors. They do have a lot of issue with the hair loss. They do have a lot of issue regarding the cosmetic appearance. So people do come forward to counsel them. They'll support with the wigs. They do support with the breast processes. All these things are there. Or one breast cancer patient reassuring other breast cancer patient. These two help a lot because India women always carry a taboo with the diagnosis of the cancer. That's one thing. And sarcoma people do lose limbs because of the salvage surgery is not possible for at least 60 to 70% of the patients. We do have a system where they do provide artificial processes, artificial like art process of the like post surviving of the sarcoma or any survivors. We get lot of support regarding their education, regarding their jobs. Even we do have a system here where they do make two cancer patients marry each other. There are certain kind of platforms are there because cancer survivors have a lot of difficulty to get remarried or married. We have a patient who got diagnosed serious cervix, post CPR because of the vaginal stenosis, and then left her. Later, other cancer patient married her.
Yeah. So that is beautiful. I think that's a nice support system beyond just the healthcare industry or healthcare system. But healthcare itself wise, everybody's being compassionate to our patients. We see variance, right? Everybody may not be as compassionate as yourself. So are the systems in place or any suggestions from that standpoint for people to
I
become
feel
more?
nurses and psychologists do play a very important role in the cancer patient journey. So most of the corporate hospitals, nurses are aiming at not just corporate, any hospital. Yeah, most of the places, they do have the clerical work to complete, the indenting of the mixing, the dilution, ticking all the boxes, registry, filling registries and all. So the clerical works, they do have very less time to interact with the patient. They don't have much time to interact with the patient, which is sort of this clerical work. And providing the human touch to the patient is most important than the clerical work. The systems are refined to take care of this clerical work automatically with the advent of artificial intelligence things better. So it happens, sisters are like nurses will have a much, they'll have a much more time feedback with the patients. And also during the course itself, we have to keep them trying how to interact with the patient. We have a pressing point. So everyone will talk about Florence Nightingale, but no one will inculcate the qualities she's having. Everyone appreciates Mother Teresa, but no one will inculcate those qualities. So during training itself, there should be a subject where communication towards the patient should be taught. I was never taught about the communication towards the patient during the training. But then the nurses also will not get taught. So they have to get taught about all these aspects. I acquired this compassion because of my grandmother from the childhood. Some other person might not be having this kind of background. Both my grandmother as well as my one of my maternal uncle, they expired because of the cancer, and my grandmother expired because of the liver cancer. So because my family got affected, I do have compassion towards the cancer patient. It's not the same with the other doctor also. Compassion should be a foundation. Every doctor, nurse should be taught about the compassion. Not just that, there is no inculcation of psychology for patients, not just cancer patient, for any patient. In cancer, psychologists plays a very important role because you have to be with the family. They're going to break the very bad, exceptionally bad news to them. So psychologists should counsel them how to cope up with the grief, how to cope up with the negative thoughts. All these things are there. The mental health is one thing no one talks about in India. So that has to be scaled up. So these two things I feel like that small improvement will make a lot of difference in patients in India.
Nice. So, so through the ages, I mean, again, I don't know. I don't think you've How many years have you been in practice? This should probably have been my early question. How long have you been practicing in oncology?
6 years. 6 years of practice in oncology.
So, do you think lessons from oncology as well? I know you're looks like you've had a wonderful upbringing and lots of examples and role models in your life, but has oncology and patients in oncology also shaped to become who you are today?
Definitely, oncology made me to realize it made me to incline towards philosophy of life a lot than anything because I do deal with a lot of mortality, morbidity, and journey with the patients are the gratitude what they show towards us because of the small difference we made in their lives. I feel so grateful to God for this opportunity for sure. And I became much better person. If I'm not an oncologist, if I took some rheumatology, what I thought out that I not have the same satisfaction in life. So rheumatologists are every branch has its own positives and negatives, but because I do deal with a lot of mortality and morbidity, I felt so philosophical. The inclination towards philosophy in life is like much more. And I became a better person at a very early stage of my life. I don't see it as just a profession. I do correlate, have a purpose in my life, have a better purpose in my life. I'm not just working to earn the money, but have a greater purpose in life to make others' life and other families, better. So that's what runs in my mind. That I perceive in the very beginning of the practice only. I perceive that.
That's great. I think it resonates very much with me too. So, I mean, I coming across these patients, sometimes 40s and 50s year old, and they just come to cardiac arrest and they can't do anything, right? And I cover the ICU sometimes, and when I see these patients like intracranial hemorrhage, the whole life changes in less than a moment of second, right? Split second. Seeing this, I feel like life or being in medicine and seeing those made me so humble about life and understand that every moment we have is an opportunity. And I think how we utilize those moments, whether we want to be frustrated or angry about the things that are not going well, or like be grateful for the things what we have in our life, right? I feel that I've started inculcating and developing that and looking at life in that angle, and I feel more happier now for understanding that aspect. So that's so true. I so resonate with you on that.
Every single day is a blessing to us. Of receiving so much of suffering, every single good day is going to be a great blessing. And one more thing I want to add is I stopped with worrying regarding petty things in life. Like if something is not going as per the plan, I used to get upset before a lot. Post oncology residency, I'm okay with it. I'm fine with it. It's okay. Because like we are grateful for every single day. So it's okay if I lose something else, it doesn't matter. Just living itself is going to be a blessing. Taking care of the family once in a while is also going to be a blessing. So each minute and each day is a blessing for us.
So, are there any things that you would suggest, or any things that the health system outside India can take from compassionate care or the care in India, despite the fact we are underdeveloped? Are the things that we could, or global physicians can take from this conversation?
So I actually in abroad the accessibility towards healthcare is not as is in India. So suppose instead of me arriving at home, I do get continuous messages from the patients. I don't say others to give their personal numbers and attend every single unit at home also to spend with the patient. But accessibility towards healthcare is very difficult compared to India. If someone got diagnosed with cancer today, then meet oncologist that day itself or the next day. But it's not same in abroad. There is a lot of lag is there towards the diagnosis and treatment also. Post diagnosis, if they get some issues, they do have access towards the healthcare, but not for the doctor. Maybe like the healthcare should be, attached to some of the attending physicians of the team, for suppose some breast oncology team. So attending physician should attend that. Maybe they should take a broker and attend it. One of my cousin got detected with that cancer in New Zealand. Between the diagnosis and treatment, there is a lag of 10 days. Usually leukemias, you can hear the day it got detected, they start treatment the day itself. There cannot be any lag. But there's a lot of like protocols which are unnecessary and there is a lot of delay, almost 10 to 12 days delay was there. I was I was so worried at the time because tumor lysis syndrome, all these things are there. So if ever she lands up in that, there is no point of it. She's still running towards OPDs to get treatment done. So these things I think matter a lot.
And I have to say, working in the US, I think we see that too, a significant lag in coming to that diagnosis sometimes, and also like after the diagnosis, coming to that treatment stage. And that concerns me generally as well, because I think I work in the admissions department, in the medical department. And when I have patients that come to the hospital with new masses, and I think sometimes that's considered outpatient therapy, right? So how quickly can they see a physician? I'm not sure. I feel like probably all that should happen. They should get admitted and get all the initial workup started off rolling, seen by an oncologist and moving. But I think I'm not definite on this. But the insurance companies don't cover for inpatient workup and stuff. I don't have all the details on that. But definitely, I think we feel like every day counts with oncological care, right? Yeah. But I want to do a few rapid fire questions, just single word if you can. We'll see how it goes. So if I say compassion, what comes to your head? What one word for compassion? What comes to your
Mother
mind?
Teresa. Mother Teresa.
And if I say self-compassion, what comes to your mind?
Self-compassion, my professor, Dr. Sudhir Gupta, more practical.
And how about healing?
Meditation.
And what one book or role model, I may know the answer for this, one book or role model or a lesson that you learned that carried for long?
My role model is Dr. Sudhir Gupta. The book I love most is Ikigai.
Sorry, what was it?
Ikigai. Ikigai. It's about
Ikigai.
philosophy of life.
Yeah, Ikigai. Yes, I'm aware. And what is one thing that you want to say to our audience? We'll have more, but what is one thing you want to?
So just a simple act of kindness towards others will make their life better and your life better. It makes entire world better. So just simple act of kindness without any ego or any negative thoughts in your head. Just be nice to everyone and make the world better place.
I would also like, now that you brought in Dr. Gupta into the picture, so I would want to understand what in him that you learned or picked up, and what is the main what are the aspects that you made him your role model?
As I say, so I have one patient who is taking, he's one of his patient who was taking endocrine therapy. So Dr. Gupta is a person who is in charge of breast cancer as well as gynecological cancer. So there was a patient who is taking hormone therapy and she's feeling postmenopausal, a lot of hot flushes, and she's unable to enjoy sex with her husband. So I started counseling her, like, let it be like, you should be alive. Lambi nahi honi chahiye, badi honi chahiye. Means like life should not be long, it has to be great. So let her be, let her have good moments with the family, let her have good moments with her husband. So that's what matters to everyone. So he changed the entire course of treatment. And I used to decline few complaints like nausea and vomiting, like small complaints would be there. Like not nausea and vomiting grade 1 is not really matter in, it doesn't really make me to change the treatment or add any treatment. But he addresses every single thing and he tries to correct things. And also he knows when to deload the treatment. And we used to multitask between his work, responsibilities and patient. No matter he's currently director of entire Tata. It's a huge work. Just like how Prime Minister works, he also will work for the development of cancer care in entire country. But still, he doesn't miss his OPD single day. He gives utmost importance towards treating patients. Then all the laurels and the administrative work. He takes a lot of pride in treating patients. That he met Joe Biden along with Prime Minister Narendra Modi. He's that kind of person, but still he always is important towards the patient and the treatment than all those power or like all those aura around. So I feel it's always important to stay as a good doctor and not to aim for positions and all. Things will flow on its way when you're doing good work. So always you have to be a good doctor. That's what I learned from, and address every single thing in patients, not to neglect any single complaint.
So yeah, That is so strong, and that is so true, right? I think even when I think about compassion and healthcare and the financial metrics we face in our systems, I feel like that's what is necessary. I think we all sometimes we run behind the money or run behind the metrics that insurance companies please us for and improve those metrics. But I feel like if we go beneath and just enjoy that and be with the patients, truly care for our patients as a whole human being and be compassionate at every moment that we can, I feel all those metrics will correct themselves and all the money will flow into those health systems. So hopefully, I think people will start looking into different angles. I mean, more and more people will be like Dr. Sudhir Gupta and also yourself. And thank you so much. So as we end, I know you kind of suggested, but as we come to the end of the conversations, are there any suggestions for our listeners that they can start or a practice that they can do starting today after listening to this podcast?
One thing I'll tell all the listeners is whatever pampers your senses, it's a poison to you and your soul. So suppose sweet is very tasty. If you're consuming it more, that will harm you. And also deep fried items, it's very tasty, but will harm you. If you're binge watching TV, it's very interesting, but it will harm you. So just be mindful about whatever you're consuming and the way you are living. Most importantly, it will prevent a lot of like mishaps in your health. That's one thing. And also be nice to everyone around. And, nothing will come with us. Though I sound like a 80 years old granny, but that's true. Nothing will come along with us. Whatever we are building, we have to give back to the society. So once you reach your comfort zone, the comfort zone threshold should be low, not too high. So once you reach your comfort zone, start giving back to society and inculcate that attitude in your children as well, so that everyone can live happy.
That's very powerful. Any practical tip that they can do each day?
I practice gratitude every day. That makes me better, being a better person. That makes me to work in a better way. So I practice gratitude every single day when I'm sleeping. If ever I prove to someone or I'm rude to any of my work or a colleague or something, I try to rectify that the next day. So I do, retrograde analyze myself at the end of the day. And also before starting the day also, I tell myself that you be kind to everyone, be nice to everyone, and take the decisions in a rational way, not to miss single judgment, not to miss any judgment in the right way, so that we can work better. So initial day, practicing mindfulness in the form of meditation or someone or a chanting or something, that will make your day to go in a better way. And also at the end of the day, you again have to understand like how the day went, what are the mistakes you made that day. So the next day will be better than this day. So that's what I practical suggestion to everyone. That makes your life more meaningful. At the end of 10 years, you'll accumulate a lot of wealth in the form of, good people around, good blessings around. I feel like I got blessed with a son after a couple of abortions. I feel my son is a blessing only because of the patients.
Thank you. And one last question I do have. Do you think the role of how we be and how compassionate we are make us feel having more fulfilled life or fulfilled as a professional?
Absolutely. Single act of compassion, at the end of the day, the profession should add a more meaning to your life, right? So it's not just financial rewarding, it should add some meaning to your life. So what you are passionate is a profession, and that should add, you're good at, you're passionate about it. If a profession, a kind of profession to take that both you're good at it and also you're so passionate about it. At the end of the life, you feel, you just end up doing right things, right time, in the right way. So, yeah. So, the profession should add meaning to your life. For suppose someone is software engineer might not have a angle what we are having, touching others' life, but they can make others' life better. For suppose inventing something, doing some app where others will access so that will make their life better. So what you are good at, what is your passion, you have to balance. And also by doing so, you contribute to the society and world. That's why I feel scientists than doctors. I think scientists are, they're more blessed. They're rewarded by being a scientist because they contribute a lot to the family. They contribute a lot to the world. Simple invention. I cherish a lot about Homi Baba. He's a nuclear physician in India. He expired because of like accident. The kind of moves he made, the kind of impact he made in the society after 100 years of his life. Still, people do talk a lot about it. I think one should have a life post their death also. That's the life, that's the kind of life I want to live.
That's thank you. That was very powerful, Dr. Bajaj.
I'm becoming so
And
emotional by, talking this because like I always like feel I should live a life where I'll have a life post my death. I hope I'll do that.
you will do that. I think it starts off with an intention, right? And that intention takes us a long way, I feel. And I think if you have that intention, you'll definitely reach there and you will. Thank you so much for sharing that practical lessons, Dr. Bajaj. Is there anything that we have not discussed and that you want to share with the world?
More discussed and wants to share to the world. So not just the medical aspect, non-medical aspect also I would love to discuss. So especially kids, children with special needs, and a lot of bullying out there, in schools and all. So let us find our kids, also people that in themselves, in their people phone. You just find them also to be compassionate towards the people with special needs. Or some people having bad days. We suppose mine idea, the council run to twist with the parents are not playing verbal with each other. So it made a lot of difference. So some people do struggle with a lot of mental health issues of office days or something. So just like going and spending some time with them. Some of the quality aspects of the text he said because of his first and all. Everyone started repented at the time when they're not spending time with them. If ever I spend some time with the person, he would have done, he would not have gone to this extent to committed suicide. So addressing mental health of opposite person is very important to face the spirit of wicked world. So whenever you find anything in the party, I'm not telling like going in the policy and like Baba Kevranga. If ever you encounter having rather please take just fight it on the top of your way and stand with them. That's only just like the pure use, but it is possible the other person. So just be nice to others and understand how things are around. And second thing, don't carelessly because that will cause others like not just your life. I've seen many families where such a carelessness is some person. Recently, the Bajaj told you about studying of one cinema's own part, which learning by and feeling key facts into a clear reason. So, enter transport home to the state of the incident. So, when you, which is something just keep against also. So, these two aspects are like
Thank you, Dr. Bajaj. I know you said you were becoming very emotional. I think I had so many moments of having goosebumps in my body. Thank you for sharing all those wonderful moments and sharing your stories and wisdom. And also, it helps us, to say, reflect on these stories and share with that. It's that compassion is not just an abstract phenomenon, but it's something that can be lived and is lived, constantly practiced, and very human. Thank you so much, and thank you for joining us on the show today.
Thank you so much, Dr. Student, for the opportunity. It made me to talk with myself. Thank you. And even with the memories that is passing out also, I'm very grateful to the God for giving me such journey with you.
My pleasure. Our pleasure. Yeah. Bye-bye.